So, Dr. Anton, when a patient comes in for a natural facelift, I now understand that the perioral area is not really benefited from a facelift. So what are some other things that you can do to that area while giving them the facelift so they can have the maximum results?
Well, yeah, you're absolutely right. You don't want to do a facelift and change the lip area.
Right.
And so we used to in the past do, a lot of times in the lip perioral area, you have lines that start forming around the lip, the texture gets a little rough, and the lips start to atrophy. So we want to address those things. And before the perioral lines, we used to address it with dermabrasion, and it would have some downside risks that we wouldn't want. And then there was heavy CO2 lasers, again, some downsides. Now we tend to approach it in a simpler, more effective and safer way. Basically, you can start with make sure the contour of the lips are youthful, not overdone, not overfilled, but just filled out from an atrophied state. Then these two filter columns that come down, you can augment those a little bit, and that also starts to help the lines. We have a fractionated CO2 laser when there are some extra lines around here and people have some texture and blemish issues on the face. Oftentimes with facelifts, we'll do the whole CO2, including a little more aggressively around the mouth, but all that heals very well over a week. Then we have some more superficial fillers that we start filling up any little lines, or sometimes the lip gets turned down a little bit and this area gets a little atrophied. So you address all these with some contouring with some fillers. Some which you can do with fat, but oftentimes we also use some over-the-counter products, box products, fillers, because they're kinder to the lips.